Hi everyone, welcome to my presentation. My presentation today is about a doctor's office. I'm presenting this because it's something many children are actually really afraid of. And on the other hand, it's something they're very also curious about. So this is my prop box. Surprisingly, fit everything inside there. So I'll just put it to the side, and then in a couple of minutes I'll just go through everything that's inside of the box. So another reason I'm using this prop box, a doctor's one, is because it lets children explore their feelings in a fun and safe way. And through this type of play, children learn about caring for others as well. They learn about health routines, what health checkups require, or what happens when you go to the doctor. And they build their confidence by trying out real life roles as well. Other things, I noticed that many children, they love pretending to take care of their friends or stuffed animals or even their toys. And they already say things like, oh, do you need medicine? Or let me check your heartbeat. So choosing a doctor's office theme connects directly to what they're already interested in. And the prop box encourages children to express themselves and ask questions about health and develop social skills through role play. It also helps them become more comfortable with things like checkups, shots, and medicines. And they learn to take turns, use new words, and problem solve together. And they play with a prop box. They can actually play different roles. Like they can be like a surgeon, they can be a different kind of doctor, a nurse, even like a veterinarian doctor as well. This kind of reminds me of when I was at practicum, and there was a doctor set up there, and I was pretending to be the patient, and I told the child that I had a headache. And then so she went to prepare her syringe, and then she came back and she actually stabbed me in the heart, and she said, oh, I hope do you feel better yet? And I'm like, yeah, I do feel better actually. She's like, is your headache gone now? And I said, yeah, it's gone. So there's a lot of creativity that happens with children doing role play dramatic centers. So the first thing out of the kit is this doctor's kit. So they can put their stuff inside of here, and it organizes all of their doctor things like a real doctor's bag. So when they have this, they feel independent and encourages responsibility. And the next thing is a stethoscope. Kids love stethoscopes. So this is for listening to pretend heartbeats. With the stethoscope, it builds vocabulary and introduces real tools. A child might put the stethoscope on and say, your heart is going boom, boom, boom. Or, while listening to a friend's heartbeat, they might make up something else. And this helps them practice listening skills and explore what doctors really do. The next thing I have is a thermometer. This is for the pretend checkups. It teaches kids health-related language. One child could hold a thermometer and pretend, or put it under like another child's arm or under a teddy bear's arm and say, oh, you have a fever, and then, write down pretend temperature, write it down, and that kind of stuff builds storytelling and health awareness as well. The next item in the kit is syringes for pretend shots or medicine. This helps children role play through fears. A child might pretend to give another child a shot, or to the teddy bear and say, oh, you'll feel just a tiny pinch, but it's okay, you're brave. It lets them play out a situation that might feel scary in real life, helping them cope with that fear. I think this is one of the most important items that a child can hold and see and help them overcome some fears when it comes time to getting an injection. I think when because I'm a nurse, this is one of the things that a child just sees and they almost like faint. They can get their ears checked, they can get their temperature checked, their throat checked, but as soon as they see a syringe, it's like the world is over. So having pretend syringes actually does kind of sort of help. So this is a good thing to have in the kit. The next thing is having glasses in the kit. This supports the character development and confidence. When a child puts on glasses and says, "Now I'm the doctor," it shows how even small props can boost confidence and help them step into a role fully. And I don't know why all doctors need glasses, but children just think that all doctors wear glasses. The next thing in the kit is bandages. So I have this kind of bandage and I have a gauze bandage. It's for wrapping pretend injuries. This promotes empathy and fine motor skills. And the next thing I have is band-aids. There's different sizes. So these are for like pretend injuries as well and small cuts. And then it encourages nurturing and problem solving. You know, a child might place a band-aid on a doll's arm or a bear or a friend's arm and say, "Oh, all better now." You know, that's them practicing care and showing empathy. And the next thing I have is a hot and cold pack. This is also for pretend injuries and maybe bigger injuries, and it teaches them about comfort and body care. So although we will not be warming this in the childcare facility, we will just leave it as a cold pack or room temperature pack for now. All right. The next thing in the kit is a pill box for sorting pretend pills. This supports early math and organization. They might say take one pill in the morning and one at night. And while sorting pretend pills, they also can count the pills that will help with their math skills and explore real world routines. And I also like that this has the days of the week on there. Okay. That's right. It has the days of the week on there, so they can learn that as well while they are using this pill box. And the next things that I have in the box was empty Tylenol boxes. I really like adding this because I think this is good for safety, because children, most households actually have something like Tylenol or Advil, but when they see this kind of box, it's like realistic packaging, so it encourages real discussions with parents or caregivers and about medicine as well. So they know if they see a box like this that, you know, maybe I need to ask my parents directions how to use it or how to take it, and I shouldn't be touching it without parents' consent, just so they're aware of what a Tylenol box might be for. The next thing I have is squeeze tubes. So this is for like pretend ointments. So you can just open it. We won't be putting anything inside, but it's just got like a squeeze thing in there. This supports open-ended play and self-care learning. And it's also a good sensory item because they're very like squishy. So I actually like this one as well. And then we have... empty vitamin container. So this is actually quite common in households. So when they see this, it feels more realistic to them as well. And it also reinforces healthy routines. And the next item I have is prescription pad and a pen. So they can just jot down something here to take pretend notes, and encourages early writing and communication. They can write things like drink lots of water and rest, or you know, write anything that a prescription, whatever comes to their mind. And then even if it's just scribbles, you know, it gives meaning to their ideas on the paper here. And the next thing I have is medication. So it's in a container, but you could kind of see that there's different shapes of medications in there. So it makes role play more realistic, and this also builds vocabulary. So I would not put smaller beads in there unless I knew that the children were not gonna swallow it or put it in their mouth. So I've used some of the bigger beads like this, and I've also added some brown ones. You can see brown, and then red, blue pills. These fake little beads are actually for the pills. The next thing I have is a cute little doctor's badge. They can wear this badge on their outfit or their uniform. So it's really cute. It's for role identity, and it builds confidence and pride in their role as well. And the next thing I have is a stress ball. It's a bunny stress ball. It's for the patients to hold, and it offers a sensory and it teaches calming. So when they squish it, like if they're pretending to give blood, you know, when they give blood, they're always told to hold like a squishy ball or something like that. So this would really help in that situation if they're able to hold it beforehand. And the next thing I have is the gown. So I wasn't able to get an actual doctor's gown, but something like this white gown would help if they want to put it on. So it really gets them into the role of being a doctor. It's for dress up and encourages like full character of the role play. And I have a doctor's office sign that I would post in the dramatic play area. So it labels the area and it supports print awareness. So they see it and they're like, oh, that's the doctor's office. And it also sets the scene for them to play. And I also have these x-ray poster. It's an x-ray poster. It's realistic, so it teaches body awareness and encourages questions as well. So when and if they ever need to go for an x-ray, they can kind of see that, oh, this is what the doctor is gonna see. And then I also included this human body book. It's got like a lot of cool stuff. So it's got it explains the body parts, and it connects to science and literacy. And also, like, a child might flip through the book and see something like this and ask questions about your body's organs and what are these for. And it gives the educator a chance to maybe have a science discussion, or, you know, right in the middle of play, or even have activities around human body or science and things like that. So this book actually has a lot of cool stuff in there that you can look at. The next thing that I have are trays, and these are for organizing their tools. It promotes sorting, setup, and cleanup. So these are the trays for their areas. And the next thing that I have is a teddy bear. I think every dramatic center area that I've seen has a teddy bear. So this pretend a patient offers comfort and helps the shy kids join in. The teddy can act as a patient. You know, a shy child might feel more comfortable checking on the teddy before they try with a peer, or maybe you know, creates open communication and some language skills as well, and it helps them open up about issues if they have any that they can talk to about, you know, with their teacher or with their parent as well. And the next thing I have is like a bedding for the play area. And this is like for it's a resting spot, so it adds more realism to the dramatic play area as well. And, you know, maybe they want to put the teddy bear on here and say, okay, now you need to rest. You have a fever still, you know, take some medication, go back to sleep. For any reason, or if they even want to tuck the teddy bear in and say, okay, good night, go to sleep now. So it actually is more for like comfort as well. And the last few things that I have in my kit are gauze pads. These are used for the pretend wound care. It teaches children basic pretend first aid. And then I have a medicine dropper for liquid medicine. It develops their fine motor skills and realism as well. And then I have some scissors different kind of scissors as well, and these are child safe, so it adds more authenticity to the doctor's kit, and it promotes strengthens their motor skills and realism as well with this, and familiarity with tools. And then I also have some empty plastic jars, so they can just put pills or something in it, and this one can be used for like pretend sanitizer, so just pretend that they're putting sanitizer on their hand. And then I have these plastic tweezers for pretend splint removal or whatever. Improves precision, like when they're going like this, trying to open and close it, and coordination as well, and their fine motor skills. I will also now just show you very shortly what the setup of my dramatic play area would look like. You're probably wondering why I didn't add mask. I had thought of adding mask, but then I didn't choose to add mask because children will put that on their faces and will cover their mouth and their nose, and so that's probably one of the fastest ways to pass on a cold or a flu or anything if a child does have one, and maybe just some facial fluids that might go into the mask. So I did not bother adding mask to the prop box. But here is my setup of the dramatic play area for the doctor's office. This is the dramatic play area for the doctor's office. So they have a little bench there. The signs are up. The patient is on the bed. The gown is hanging there. And we have everything organized on the shelves. Probably won't stay this way at the end of their play day. So everything is there. The book is at the bottom. They got their kit, the stethoscope, the shelves. Everything is on here as well. Then they got their medication section, and this has all of their little tools, gauze pads, scissors, tweezers, everything else that they need is in there. So this is the section for the dramatic play for the doctor's office. So I think all in all, this prop box, it is good because it encourages language development, and they use things like heart and bandage, prescription, emotional development as well, because they're practicing care, comfort, managing feelings, and getting a real, kind of like a real life look on what doctors do in the office as well. And it's good for social development because they're taking turns, they're listening, creates empathy and coordination in group play, or even in individual play. They learn how to talk with a teddy bear, and they can act out that with a peer as well. And cognitive growth as well for this prop box, because they're solving pretend problems like my teddy has a fever, I don't feel good, or you know, my teddy needs to rest and has a headache or needs an injection. So they're using a lot of words, and they're expanding their vocabulary. So, and they ask a lot of questions. You know, it's all about their imagination, what's happening to the teddy bear or their pair. So the goal for this was so they encourage creative expression and imaginative role play. Another goal was to promote communication and teamwork. And the third goal is that it supports understanding of humans and human health and the body of humans as well. So in conclusion, I think this prop box gives a meaningful and exciting way for our children to explore and learn through this kind of play. It supports so many different kinds of areas of development, from language to empathy to science. I really enjoyed putting it together, as this is my field from before starting early childhood education. So for me, it's very, it was actually really fun to make this prop box, as I had a lot of this stuff already, but yeah, and I'm glad that I was able to do this prop box and help children overcome some of their fears. Thank you for watching my presentation.